Nowadays, we're hearing a lot about vaccine mandates for government workers, and many large corporations are jumping on board as well. But what about your physician and dentist? Do you expect them to be vaccinated, and should they expect the same from you? This is going to be a good one. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. So I gotta confess, it's times like these that make me very grateful to be retired. I've spoken to several of my colleagues who are still practicing, and all of them agree that these are very stressful times for everyone. Even though I'm no longer practicing, I do keep up with continuing education and topics that affect dentistry. So the other day I came across a video from a Dr. Arthur Kaplan, who is with the Division of Medical Ethics at the NYU Grossman School of Medicine in New York City. And he was talking about a physician in Alabama who had had enough and was no longer going to treat patients in his practice unless they were vaccinated. And although it wasn't completely spelled out in the video, it sounded like any new patient would have to prove their vaccination status to be accepted into the practice, and any existing patient would need to do the same to remain in the practice. This physician stated that he was under too much stress worrying about what was going to happen to his unvaccinated patients. Well, Dr. Kaplan felt that this was not a good enough reason for his actions. Instead, Dr. Kaplan stated that had this physician simply said that he was concerned for his own well-being and the well-being of his staff, that this would have been both legally and ethically solid ground for doing what he did. Furthermore, he went on to say that the doctor-patient relationship should be one of mutual trust. The patient trusts the doctor for their care, and the doctor trusts that the patient will follow their instructions. Refusing the advice to get vaccinated was considered a breach of this trust and a dismissible offense, since the doctor, staff, and other patients were now at risk due to this refusal. Easier said than done, I'll admit, but allowable nonetheless. He went on to discuss how this is obviously not allowable in hospital intensive care and ER settings, which makes perfect sense since there is a legal and ethical obligation to save the patient's life and to get them stable. Now, the comments on this video from physicians were all over the board, from some saying good for this physician as it was about time, to others saying that this violates the oath that we doctors take to do no harm, to everything in between. So I got to thinking about this dilemma from the standpoint of a dental setting. If I was still practicing, what would I do? It's not an easy question to answer outright. I mean, what if I got sick as the result of an unvaccinated patient? Or a breakthrough infection took out my entire staff? I mean, there's not only health consequences, but financial consequences as well. Would I not be justified to require vaccinations? And this just doesn't apply to patients. Can I require all staff members to be vaccinated as well? The answer to that question varies state by state. Some saying you can require employees to get vaccinated, others saying you can't. You know, when it involves healthcare workers, the general public may have stronger opinions when compared to, let's say, whether or not your cashier at the grocery store has been vaccinated. We're seeing on the news about nurses losing their jobs over vaccine mandates all around the country. As a patient, do you expect your doctor to be vaccinated? And how would you react to a vaccine mandate by your doctors? You know, thinking about it, I think dentistry has such an excellent track record in utilizing universal precautions and infection control going back to the AIDS scare in the 80s involving a dentist that I don't think vaccine mandates would be necessary today. But again, I'm no longer practicing, so I guess my opinion is moot. Now, for those who don't know, universal precautions in the simplest of terms means that a medical or dental office considers everyone as if they were possibly infectious, whether it be HIV, AIDS, hepatitis, or COVID. And we simply take the necessary steps to protect ourselves in the form of goggles, masks, face shields, gloves, gowns, and so forth. This is all kind of second nature to us, and of course, we all want our patients to know how stringent our infection control measures are so they can feel safe in our office as well. Getting back to the video I was talking about, this was the first time I had heard about a doctor taking such measures, and it would not surprise me if this became more commonplace. So how about it? Would you comply with a vaccine mandate issued by your physician or dentist? Let me know in the comments below. Hopefully one day soon this will all be past us, but until then, let's remain vigilant, respectful, and caring towards each other regardless of where we fall on this issue. Okay, well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing, and be sure to hit that bell icon so you can be notified of future videos on Dentistry Made Simple. Bye-bye.